Yes, Honorable Gisham. Okay. Honorable Joseph Kuriatu, anybody holding his brief? Chairperson, Committee on Youth Affairs, Sports. It's not around. In that case, I refer the matter back to House Business for rescheduling. Next order.
Mr. Speaker, sir, still under order number 8, we have another motion to be moved by Honorable Paul Ngesho-Wambaire, the Chairperson, Committee on Health Services.
Very well. Honorable Paul Ngesho-Wambaire, Chairperson, Committee on Health Services, member for Kipipiri Ward.
Thank you, Mr. Speaker. Mr. Speaker, I beg to move the following motion, that this House does adopt the report by the Health Service Committee on Nyandarua County Roadcam Policy 2025 as a report of this House. And the recommendation therein as the resolution of the House. Mr. Speaker, the Committee on Health Services is a sectoral committee with a very critical role in the county. I appreciate the honorable members for the rigorous executing their mandate of representation and oversight. I also wish to thank your office and that of the clerk for facilitating the committee and offering the relevant technical expertise through the Secretariat in pursuing its core mandate. I extend my appreciation to the members of the committee for their commitment and believe that we shall continue to expedite our mandate with diligence and goodwill for all our electorate. Mr. Speaker, it is my pleasure and duty on behalf of the committee to present this report to the House for consideration and adoption. We received the Roadcam policy. It has consistently constituted the principal agenda of the committee's meeting to enable members to study, analyze, and gain a clearer understanding of its provisions and implications. The committee has undertaken a thorough review process to ensure that all aspects of the policy are carefully examined, with particular attention to its operational, financial, and administrative impact on the delivery of health services. Further to its internal deliberation, the committee convened a consultative meeting with the Department of Health to delve deeper into the contents of the policy and to seek technical clarifications where necessary. This engagement provided members with valuable insights and enhanced their appreciation of the policy's objectives and implementation framework, thereby strengthening the committee capacity to make informed observation and recommendation. Mr. Speaker, Nyandarua County Roadcam policy provides a structured framework for the temporary engagement of qualified healthcare professionals to address staffing gaps arising from leave, vacancies, emergencies, training, and service surges. The policy aims to safeguard continuity of care across all county health facilities while ensuring transparency, accountability, and physical discipline. The framework is anchored in key national rules, including the Constitution of Kenya, County Government Act, Health Act, Employment Act, and Public Finance Management Act, ensuring legal compliance alignment with public sector governance standards. The policy is comprehensive, well-structured, and administratively sound. It clearly defines approval hierarchies, documentation requirements, remuneration structures, performance oversight mechanisms, and audit processes. It also emphasizes that Roadcam engagement is a temporary intervention and not a substitute for permanent human resource planning. If effectively implemented, the policy will significantly reduce service disruptions, enhance financial accountability, and strengthen governance in local management. What are we saying, Mr. Speaker, is that you find already we have a shortage in the Department of Health in terms of HR. Now, we want to have contracts. These are a small contract, short-term contract like 3 months. You engage so that you bridge the gap. If a facility in a certain ward, like Murungaru, the nurse is only one. She goes for a leave. We are giving the department the powers such that it can be able to recruit, to hire, such that even if she is out there, she is immediately, instantly replaced. The services are offered to the constituent. So, upon reviewing the ROCAM policy, the committees find it both necessary and well justified, as it effectively addresses several critical service gaps, and this includes where instances where regular staff are on approved leave. You see, there could be paternal leave or maternal leave. Sometimes they go to for the study leave, or other times they have forced leave, like the sick leave. B, there is vacant position pending recruitment or replacement. Let me cite an example. Sometimes back, the life of nurses are claimed through road accident. What happens before now they are replaced? What happens? The accident has occurred today. What happens? Should this now facility close down? It should not close down, but we should get somebody who starts in as now due process take place. C, periods of increased workloads, such as during mass immunization campaigns, outreach program, or emergency responses. Take an instance of COVID, the time of COVID. It is unprecedented. What happens if we don't have a team standby that we can hire? Number D, the need to maintain services during night shift, weekends and public holiday when regular staff are unavailable. Let me cite an example. We have Demi Health Center. It's a big one. But you find that you have only one nurse. It should run 24/7. And this, she is overwhelmed, or he is overwhelmed. What happens now with the department? Yet we have shortages. We don't have the right number of the HR. E, temporary requirement for specialized experts, such as radiology, anesthesiology, or oncology. These are specialized. Like now we have the visiting cardiologist every Thursday to our JM hospital. You see, how should you enumerate this particular cardiologist? We should have framework. And now this one solves the problem. F, public health emergencies affecting the county, including disease outbreaks, floods, or other disaster. I cannot see I know he is around, Honorable Duogashino. Sometimes we had some kind of outbreak around that place. So what should the county or the health department do in such instance? This policy now gives them a leeway such that it can be able to hire. Mr. Speaker, there is a process of engagement of ROCAM officers. How should it be done? The committee further observed that the process for engaging ROCAM officers is clearly defined and procedurally sound. The policy outlines a structured approach that entails Identification of need. Identification of need is done by, or it should be initiated by the facility in charge. Right now we are clocking around 90 facilities. Every in charge there initiates, he or she should initiate by identifying a staffing gap and prepare a ROCAM request, and that one he should specify reason, the kinda required. Is he a clinician? Is he a record keeper? Duration of service, budget source, because sometimes back in this assembly, Mr. Speaker, we passed the Facility Improvement Fund. And this is where we are anchoring the source of fund. It should be from the Facility Improvement Fund and expected deliverables. This is about how to measure. It should be measurable. Then we have verification and review. This is where the sub-county health management team reviews the request. And now they should look at the validity of need. They should ascertain the budget allocation, and also they should justify the terms of engagement. Why should we engage? So, Mr. Speaker, the committee reaffirms the need of the CHMT, that is County Health Management Team, to always ensure and confirm the availability of budget provision before engagement of any staff under ROCAM. We have the roles and responsibility, Mr. Speaker. The committee noted that the ROCAM policy clearly delineates the roles and responsibility of key officers at all levels of the county health service system, thereby establishing a coordinated and streamlined implementation framework. So, approval hierarchy, Mr. Speaker, I have mentioned the facility in charge, the sub-county medical officer of the sub-county team. They review and endorses justification. Then there is county director of health services who verifies compliance with the policy. And after that, there is chief officer health services who approves engagement and authorizes HR action. And this one, we say there's a committee in conformity or in tandem with the CCM in charge, because the CCM should have the grip as well. There is human resource office. It is to prepare the contract and maintain the records. So, Mr. Speaker, sir, the committee noted that each engagement must be justified through documentation demonstrating the service needs, the duration kind of required, and expected outcome. So we have the policy strength. The committee observed that the policy framework is robust, well-structured, and responsive to the governance and accountability demands of the health sector. The committee identified the following policy strength. We have a strong governance and legal alignment. The policy is firmly grounded in constitutional and statutory provision, reinforcing legitimacy and foreseeability within devolved health governance structures. B, we have clear approval and oversight structure. The multi-level approval process from facility in charge to chief officer ensures checks and balances, reducing the risk of unauthorized or unjustified ROCAM engagement. The issue of physical accountability measures, the budget source identification, verified attendance records, consolidated monthly payment summaries, quarterly expenditure review, and annual audit. These provisions promote prudent use of public resources. D, we have standardized documentation, inclusion of annexed templates that include request form, contracts, attendance sheets, and quarterly reports, enhances operational clarity, transparency, and audit readiness. we have the conflict of interest safeguards. The policy prohibits claiming locum pay during official working hours. There is the issue of double engagement without disclosure, and then there is undeclared concurrent employment. These now strengthen the integrity controls. There is power delegation by the County Public Service Board. Mr. Speaker, Section 86 of the County Government Act 2012 provides that the County Public Service Board may delegate in writing any of its function to one or more of its members or specified county officers, including the county secretary, county chief officers, some county to mention but a few. So, Mr. Speaker, the committee now recommends Roman 1 that the House approves the Nyandarua County locum policy and recommends its adoption by the Assembly, and further recommends that Roman 2, the Department of Health Services must engage the CPSB with the view of obtaining delegation of power to be able to recruit locum officers in accordance with the County Government Act 2012. Roman 3, the County Health Management Team shall always ensure and confirm the availability of budgetary provision before engagement of any staff at a locum. And Roman 4, that we are approving the engagement of the staff at a locum, the chief officer should seek conformity with the CCM for health services. Mr. Speaker, even before I conclude, there is the policy itself. Even before we conclude, Mr. Speaker, there is a section that we ought also to amend, Mr. Speaker, and that is about recommendation. That recommendation 4. Let me come again, Mr. Speaker. That while approving the engagement of the staff at the locum, the chief officer should seek conformity with the CCM for health services. The word in conformity, it should not be in conformity, it should be in concurrence. You see, in conformity, it could be he or she is dictating. So it is concurrence. They are creating concurrence, Mr. Speaker. So that one, Mr. Speaker, that I will be moving that recommendation, that recommendation, so that he should not seek conformity, rather he should seek concurrence. So let me read this section of conclusion, so that before even I call the seconder, I just move that one, so that it read in concurrence. But this is with your leave, Mr. Speaker. So, Mr. Speaker, implementation of the locum policy will enhance continuity of health care service delivery, promote prudent and accountable utilization of public resources, strengthen integrity in human resource management, and substantially contribute to addressing the prevailing staffing gaps within the health sector. Mr. Speaker, you see, the health sector in our county, it was aiding. Now we are providing solution. We are providing a good dose so that we can heal the department, so that it can be very effective and it can heal now the community, the people of Nyandarua. So, Mr. Speaker, with your leave, I wish that we amend recommendation Roman 4 by deleting should seek conformity with the CCM for health services and replace with in concurrence. In concurrence. And I call Honorable Kungu to second the amendment.
Yes, proceed, Honorable Kungu.
Thank you, Honorable Speaker. First, I am a member of the committee, and we had a very in-depth discussion on these resolutions, and I agree with the chair. Initially, in the original ROCAM policy that was submitted to the House, there was no requirement for concurrence with the CCM for health services. But we know, Honorable Speaker, there was some time back here that we had an issue in the Department of Health where the chief officer had done some transfers, some people had deployed elsewhere, and when we requested the CCM Health to explain, they said that they were not in charge, such that the chief officer had the whole mandate to do anything to do with staff without even agreeing or discussing with the CCM. And because this is a matter of policy, it's a policy matter, this will come, we felt as a committee it is good that the CCM or the chief officer must be in concurrence with the CCM health services. So I second that amendment from conformity to concurrence. Thank you, Honorable Speaker.
Thank you. I now propose that the report be amended at the recommendation number 4 by deleting the word conformity and inserting thereat the word concurrence. I now put the question that the report be amended at recommendation number 4 by deleting the word conformity and inserting thereat the word concurrence. May those of a similar opinion say aye. May those of a contrary opinion say nay. And the ayes have it. Chairman, you can proceed.
Thank you, Mr. Speaker. And I now call the seconder, minority leader and member of our committee, Honorable Mwangi Geshoke, for Engineer Ward.
Very well. Minority. That committee appears to have a very powerful. I don't mean any other committees don't have powerful. No. I meant it appears the entire leadership is there. Yeah, proceed, Honorable Minority.
Thank you, Mr. Speaker. Actually, you're not wrong. It's one of the powerful committees dedicated, and I wish to second the local policy. Mr. Speaker, it is a very well thought policy in that we have had chances where, because of scarcity of staff, either because they are on leave, either because there is a circumstance that is beyond their availability, being able to be available in the hospital, we find that our patients are suffering a lot. The local policy gives us an opportunity to quickly fill gaps. Say, for example, if we have a nurse in Kahuru dispensary, in engineer, is only one, the clinical officer who attends to our patients. For whatever reason, if he is not available, means we close that dispensary until such a time he's able to come back. The local policy is now giving us an opportunity to note before that the officer in the Kahuru will have a need to not appear on station for the next 3 weeks. Local policy now allows the CCM together with the chief officer, after the thorough verification that we have, the policy has put, to look for somebody else of equal capacity and ability, a professional, to fill in that gap for those 3 weeks. The great departure between now the local policy and employment is we will have a list of the number of available medical assistants, nurses, specialists who are on call, that when a need be, they are within reach and they can be quickly called to duty. Take, for example, a case example of, God forbid, if it happens, like accidents, where you may find that a major accident has happened between, say, for example, Kalau here and our JM hospital. And the number of nurses available to cater for such an emergency are few. There will always be, at any time, a list of on-call doctors who can quickly be mobilized, and they are able to come, and they are going to be of great assistance to ensure that that particular problem has been resolved quickly. Again, you realize that as a hospital, as a department, we also have specialists which we have still not been able to employ, the neurosurgeons. These people where we have specific cases of need, but they have not been enlisted in our permanent and pensionable basis. We are now going to be able to create days when it is known by our general public that, say, for example, every Fridays, we have a neurosurgeon who is on call, and that if you have such a problem, you can be able to visit our hospital. This now removes a situation where we have to employ fully, although we need to employ our own specialists as a requirement of both the level 5s and level 4 hospitals, which is a requirement that we must have specific specialists with us. But what we are saying, the locum policy now helps us in that a patient may not necessarily be told to go home because we do not have staff so and so. It now gives the CCM together with the chief officer room to be able to flex and be able to employ quickly on temporary basis. Lastly, the amendment which has just been passed, the purpose of it is because we also don't want the locum policy to be misused. And we have extreme faith with our CCM. That is why we are trying to put in some measure of concurrence between the decisions the technical people have done, between all the way moving from the facility in charge, who is the one who initiates the process, up to the last person, who is the chief officer in this case, who is supposed to approve for purposes of HR to be able to appear to have employed this person. But we also put more safeguards, because the other thing the committee was concerned on was that there is possibility that, again, people will, for some reason, exempt themselves from work for no good reasons, because there's a way so we can get people to come and cover for them. Remember, again, the locum does not, especially when you are on leave, it does not mean that we can't take you when you're on leave, although there is also a requirement that we cannot take more than half of your leave. So people may want to now take leaves so that I can come back, because there is some stipends which are being paid. So we also are trying to put some structures ensuring first that facility, specific facility. I want to say, for example, my Kahuru dispensary. If it is the one that requires a locum officer, it is that facility, specifically that facility, to pay. It must demonstrate that it has the money ready, not to come and ask our budget chair sometime later that we did not have enough money, so give us some extra money so that we can pay. So we have put those safeguards to ensure that the facilities must demonstrate, before bringing in the locum officer, must demonstrate that they have ready cash to be able to pay these people, because they're supposed to be paid as stipends and work at a maximum of 8 hours. So, Mr. Speaker, I wish to second and, of course, still continue to ask our Department of Health, which currently is doing a bit better. There is significant progress in the way they are handling their internal affairs, that we encourage them to use this as another level of putting our healthcare at a higher level, and to gain more confidence by the people we are called to serve all the time. I wish to second.
Thank you, Honourable Minority. I now propose the question, which is that this House does adopt the report by the Health Services Committee on Nyandarua County Locum Policy 2025 as a report of the House, and the recommendations therein as a resolution of the House. Yes, Honourable Kongo.
Thank you, Honourable Speaker. I'm very glad today, because this is for the second time that we are having the locum policy. during the COVID time in the second regime of Nyandarua county government, we tried to have a low-camp policy, but I think it was not very framed such that we feel that it was subject to be misused, and it flopped, Honorable Speaker. But this time around, we have a low-camp policy, and as a committee, we have been able to scrutinize it, and we are able to look at all the loopholes, and we can assure this House that with goodwill, this is the best thing that would happen in our health sector. Honorable Speaker, we know that there is a very big shortfall when it comes to the different cadres within the health department, and there is always a request for new hiring, and as you know, we are challenged because of the compensation to employees. As already there is a wage, our wage bill has ballooned, but with a policy now, it is going to deal with the gap that we have been having. Of importance, Honorable Speaker, that I would like the members to note is that initially, before the FIF, if there is anything that happened to this country, and if it looked properly, that is going to transform health sector, it is Facility Improvement Fund. Initially, Honorable Speaker, the county government of Nyandarua was setting aside between 70 and 100 million, which was transferred to our facilities, health facilities. This is the money that was taken to the facilities to run the facilities. Day-to-day running of the facility was done through facility transfers. And Honorable Speaker, you can imagine our FIF, we are now estimating it is cropping up, it would be even around 400 million. So it means there is 4 times more resources in our facility than it is used to be before FIF. And that is why now, when we subject this policy, we know it is going to work. Because if initially they were running the facility using 100 million, now they have 400 million. There is some surplus that now can be budgeted and come in to cater for the gaps that we have been having when it comes to HR. So, Honorable Speaker, as a committee, we have been able to look at this. We have looked at every area, and we know that there are enough resources now. I don't see why, going forward, we should be having 1 nurse per dispensary, such that when that nurse wants to take returns at the sub-county level, maybe on a Monday or a Tuesday, the facility is closed down. That should not happen. Because I can attest to you, such a small facility like Kikefuruti, when it comes to FIF, it is even earning more than 1.5 million. Initially, they were getting 300,000. So they can be able every week to be having a nurse who will come and study in when that nurse is not there. So our people in Nyandarua will get services actually 24 hours. I think going forward, we should even encourage that these dispensaries should run for 24 hours, whereby we have a nurse during the day and another nurse at night. Because you never know when the disease can strike, and you see the first service should happen at that primary level, Honorable Speaker. So I am very grateful. We call upon the executive and more so the CCM Health to make sure that this policy is implemented according to the recommendation of the Health Committee. Thank you, Honorable Speaker.
Thank you. Yes, Honorable Matimo.
Mr. Speaker, I want to take this opportunity to thank you for giving me this opportunity to really thank the Health Committee for coming up with this local policy that will be a game changer in our county. Mr. Speaker, as the honorable members who have spoken before me, I think this is a policy that is long overdue. It's a policy that we could have passed a long time ago. Because with the shortages that we've been experiencing in our health facility, this is a cure for the same. And I believe going forward, we shall not be having cases whereby our facilities are closed, our facilities at times, we shall not be hearing of any particular time that we shall not be having adequate staffs in our health facilities in the entire county. Mr. Speaker, sir, I support this, and I believe that the department will use this opportunity to ensure that our people will gain meaningfully in terms of health matters. And Mr. Speaker, I believe even it will also go a long way to even motivate our health workers, because when you know that you are getting an extra penny in your salary or in your pocket, Mr. Speaker, you'll be there to work hard. And I'm grateful that the committee have promised that they've really looked into the policy, they've looked at the gaps that are there, including what the chairman has just amended this morning. Mr. Speaker, I support and I call the mover.
Yes, mover, you can respond.
Thank you, Mr. Speaker. You see, Mr. Speaker, Honorable Steve Matimo, he is one of amicus curiae to the committee. So, and we are very happy that indeed we can see the good fruits of this committee. And Honorable Matimo is one of the champion of seeing change, and this change is the change manifesto, the Badilisha, and it's good. So as Honorable Isaac has indicated that even these dispensaries should now be 24 hours. They should operate 24 hours. That's a debate that is being opened, because we have now, we can have reliable staff. When you return the nurse returns, do her returns to the sub-county office, there is no need to close that particular facility. And that one we will oversight. After now we have passed this policy, we will be giving a report. We will be measuring the efficiency and effectiveness. Mr. Speaker, as the seconder has indicated, that this is timely. It is timely that we are going to cure the issue of Kahuru being addressed there. Any other facility, anywhere, from Kenton to Carampton, it is addressed. It is well addressed. I know it is small steps that will bring out results. As the chair budget has indicated, Mr. Speaker, we must appreciate the revenue being generated by this facility. We are clocking $500 million. And in the year, Mr. Speaker, little was being corrected from this facility. And in the spirit of this policy now, you might get it clocking around 600 to 700 million. And what does this translate? It translates more of our money now will go to development, because our hospitals are self-sustaining. They can sustain themselves. They don't require a county budget any other time. That is where we are heading. And I don't want to use the word Singapore, but we can benchmark whether that is how the Singapore was doing it. So, Mr. Speaker, I'm very happy that we as a committee, that we are able to come up with the facility improvement fund. That is already in our scorecard that can be marked. And now we are headed now to the policy we have other item in our shelf, Mr. Speaker, and we will be soon implementing. We have like the corporate policy, whereby, Mr. Speaker, I don't want to introduce this. I am just touching something to do with how now we can rebrand our hospital. We can include even to have a private wings that we are going to take care of a particular group of people. And we will not stop at this particular policy or bill, Mr. Speaker. And in that spirit of supporting this, I now move.
I now put the question, which is that this House does adopt the report by Health Services Committee on Nyandarua County Law and Policy 2025 as a report of the House and the recommendations therein as the resolution of the House. May those of a similar opinion say aye. May those of a contrary opinion say nay. And the ayes have it. Clerk, next order.
Mr. Speaker, the business in the main order paper has been exhausted.
Honorable members, as you all know, the sitting of yesterday, the 3rd day of March 2026, at 9:30 a.m. was affected by a quorum hit due to the weight of the businesses of that sitting and the need to expedite their consideration. I directed the clerkship to prepare a supplementary order paper for the purpose of transaction of the said businesses. As such, I direct that we proceed to the supplementary order paper. First order.
Order number 1, administration of order. Order number 2, communication from the chair.
I have no communication to make.
Order number 3, messages. Order number 4, petitions. Order number 5, papers. Under this order, there are 2 papers to be laid. The first one is by the leader of the majority party.
Very well. Leader of, yes, Honorable Whip.
Thank you, Mr. Speaker. On behalf of the majority leader, who I'm told has been unwell, I will read the report. The Office of the Controller Budget is established under Article 228 of the Constitution of Kenya. Sorry. Sorry, Mr. Speaker. The County Government's Budget Implementation Review Report for the first quarter of financial year 2025-2026, and I table.
Thank you. The report is duly tabled. I refer the report to the Committee on Budget and Appropriation. Chairperson, how many days do you need to report back to the House?
Thank you, Honorable Speaker. Honorable Speaker, this morning, I want to move a motion on the report of the Committee on Budget and Appropriation on the Nyandarua Budget Review Outlook, that is CBROP 2025, as a report of this House and the recommendation therein. Honorable Speaker, I'm going to be very brief because this is a report that has been in our has been given to members for the last of whole week. So I'll make sure that I'm very brief when I'm discussing this report. Honorable Speaker, this is one of the very important reports when it comes to the budget cycle. It's part of budget reporting. Even, Honorable Speaker, as you have given us today this morning, the report by the Controller of Budget on budget implementation, CBROB is a document that produces a very in-depth analysis and assessment of a county budget. Actually, it shows how we have been able to implement our previous budget and what is our target for the next budget. Allow me not to go into the legal issues on how and where, according to the PFMA Act and all that, but allow Honorable Speaker to say that this document was tabled on 11th November by the CCM Finance, and upon being tabled, it was submitted to the committee, and the committee has taken time and has looked at the report and have come up with various recommendations. Honorable Speaker, one of the things that we look in the CBROP, number one, we look at the details of the actual financial performance in the previous year compared to the budget appropriation of the year. I have noted that members have a lot of concern when we are passing the budget. Everybody is concerned because they are looking at whatever is going to the awards, whatever is happening within the county. But it is quite important to look at what happened. After we came to this house and appropriated money, what happened? That is the CBROP. That is the report we are discussing today. What happened? Honorable Speaker, the document also updates economic and financial forecasts with sufficient information to show changes from the forecast in the most recent county fiscal strategy paper. There are deviations that happens during the fiscal strategy paper. It also indicates the deviations that happens. Honorable Speaker, allow me for most to concentrate on chapter 2, which includes the fighting. And I want to say as follows, Honorable Speaker. In 2024-2025 financial year, the county total resource revenue amounted to 8,779,773,471 as per the first supplementary budget. This entailed 5,936,521,652 as transfers from the national government. We also had 478, 085. These were money that were not remitted in 2023-2024, but we received them in 2024-2025. We had a target revenue, which was 600 million. We had 250 million FIF. We had 1,769,930, that is grants from the national government and other development partners. We had 505,979,873 unlimited conditional grant in the previous year of 2023-2024. We also had 10 million of unspent balances. By the time we crossed the year in 2023-2024, in our accounts, we had 10,023,930. So we have given a total of 8.7 billion on how the sources were. Honorable Speaker, how did we perform in our revenues? I really want to note, Honorable Speaker, for the first time, I think since devolution, the counties received their total money from shareable revenue, from the national government. Every other time when the year is coming to an end, we have not received money for June, which now is transferred to the next year as balance brought forward. But this time round, there was no balance brought forward. The government or the national government made sure that it gave the counties all their monies, and so all the money that were expected from shareable revenue as 5.9 billion was received. The arrears that were for 2023-2024 was received. Honorable Speaker, we targeted to collect 600 million in our own source revenue, but we collected 370,706,404. That is 61.8% of our target. So I think the finance department, the defense committee, I don't know whether they are out. You should also note that we had a shortfall by 28% of our target for own source revenue. What does that say, Honorable Speaker? Automatically, it translates to pending bill. There were projects that were budgeted for. We expected to collect 600 million. We collected 370. We have already created a pending bill of 240 million automatically, since we did not meet our target. Honorable Speaker, the other thing I want you to note, I want us the House to notice that we had a target of 250 million for FIF, that is Facility Improvement Fund, but we surpassed that by 32 million. So we had targeted 250, we collected 282, 528, 978. That is 113%. So we surpassed by 13%. Honorable Speaker, it is good for the members to note that FIF is money that we are receiving from SHA. Initially, our primary health facilities, it was free. We were not receiving any revenue from dispensaries and health centers because there were no charges that were done to the patients who were in those hospitals. But with the coming of SHA, universal health care, every patient who goes to the hospital and is registered, there is a reimbursement by the national government. And this, what does it tell us, Honorable Speaker? That we should recruit and do campaigns. Because the reimbursement that comes to our health facilities, that is the dispensaries and health centers, it doesn't matter whether the patient is paying SHA. As long as you are registered and you have received a service at the dispensary or health center, the dispensary or the health or the facility is able to seek for reimbursement from SHA. And as a result of those people who have registered in Nyandarua, and they have sought services in dispensaries and health centers, we have received 280 million. So we tell members to encourage our constituent and the Nyandarua people, those who have not registered. It doesn't matter whether they pay monthly subscription or not. As long as they are registered and they have sought a service, we will get a reimbursement as a facility. So we should encourage. I know it is very sensitive political matter, but we should encourage our Nyandarua people to register for SHA so that we can decrease this target from 280 now to around $500 million. This is money that goes back to those facilities, and it is going to improve services and even development within those facilities. Honorable Speaker, the other thing that we would like to note is that when it comes to our grants, we had targeted a number of grants that were not remitted, they were not received. For example, if you look at the road maintenance levy, we were expecting to receive 78 million, which was not received. And there is a problem with grants, because sometimes we are promised so many grants by the national government or our development partners, but by the end of the year, you realize that the remittance of those grants has not been done. And so those projects that were entailed in the budget are not done, or they do not continue. So, Honorable Speaker, I don't know. This is an area that we need to seek clearance with the national government, because when we come here and budget, we go and promise our people that we are going to do. You have seen what has happened to KAIP and others, and yet this money is not released. Otherwise, Honorable Speaker, we received 41 million from NAF CDP. We received 282 million from KISIP. This is money that is upgrading the informal settlement at Kaibaga, that is at Kaibaga, and also in Jabini. We also received 32 million from KUSIP, urban support. We also received 5 million from the NIDA to support health primary care. We also received 9 million from FROCA, and also 272 million that was conditional grant for the previous year was also released. Honorable Speaker, we also noted that there was a problem when the CPROB was prepared in comparison with the COB reports. There were some discrepancies. For example, Honorable Speaker, the COB report recorded that county had actual revenue totaling to 7.9 billion, 40,129,665, while CPROB having a varying figure of 7,957,168,468,000. This is a variance of 17,038,803. Honorable Speaker, there was that variance that we could not be able to tell. We cannot explain why there should be that variance, because whatever was prepared in the CPROB should coincide with whatever we received from the COB. That tells you there was some money that was not considered within our budget that was received in the county. Honorable Speaker, we have given a table of how much money was received that is the what we call the grants. We have given what was received, what was expected, what was actually received, and what was not received. Honorable Speaker, allow me not to repeat, because I've talked about that. But there is something I wanted to discuss, Honorable Speaker. absorption. You realize that the absorption rate for recurrent was 96%. Whatever we gave for recurrent was 96%. But the absorption rate for development was 60%. That tells you we chewed money that was supposed to drive development, but we did not drive that development. But of importance, Honorable Speaker, it is good to note that there are some departments that are very, very, very frustrating. If you look at Department of Education, Children, Gender Affairs, Culture, and Social Services, they had only 59.4% absorption on development. And that is why I wanted the chairs of various committees to be here. Because most of the time we come here and clamor for resources. But when it comes to absorption, they don't absorb. And I think this is for the third consecutive years. There is a problem in the Department of Education. And this happens when it comes to the ECD. There is a lot that is happening. We have so much many uncompleted ECDs that are not procured. You can see they are 59.4%. That is what. Another thing, water. And I thought it is the rust. You know, our third consuming department in terms of resources is water. Environment, climate change, and natural resources. But they had only 34.7% absorption. Honorable Speaker, it is very frustrating that we allocate money to this department. Out of 100%, they absorb 34%. So, again, I am seeking the departments or various sectoral committee to come and look at this report and go back to their department and ask them, do the real oversight. Why are you being provided with resources and you are not absorbing? Because this is where now they are creating pending bills, they are creating confusion. You give them money, but they only absorb 34%. So, Honorable Speaker, I'm calling upon the sectoral committees to come in, look at this report, look at the performance of each and every department, their respective department. Ask the CCM or the relevant accounting officers to come and explain why they could not be able to absorb money. Honorable Speaker, allow me to read the fiscal responsibilities. These are issues that tell us whether we are within our fiscal responsibility. Number one, when it comes to debt, Honorable Speaker, we had 342 million which was paid for pending bill. That is around 6.67% expenditure. And then when it comes to the wage bill, Honorable Speaker, we had a wage bill of 37.65%, which is above the 35% expected. So we are not within the fiscal responsibility of an expenditure on wage bill. When it comes to the assembly, we are at 10.28%, above the 7 required. But again, we always say that this is negotiated at the CRA, and it is within our budget as approved by the CRA. The county government actual expenditure shall not be less than 30%. It is also good to note, due to lack of absorption by the committees, by the departments, we only had 26.63% for development. That tells you it is below 30 because we could not absorb money as allocated by this House. Honorable Speaker, allow me to skip chapter 3 on medium-term fiscal framework because this is what we'll be discussing in our CFSP. The medium term, that is what we'll be discussing. More so, it deals with the CFSP. The same report we'll be tabling here in the next 2 weeks. So allow me now to go to the recommendation of the committee that the resource envelope and indicative ceiling for the sector department provided in this budget review and outlook paper form the basis for the formulation of the CFSP 2026, that the county should develop and implement strategies to enhance own source revenue. As you have indicated, we had a deficit of 29% or 240 million. That the county treasury should ensure the expenditure on an core budget item is rationalized to provide more resources for development. You have noted they absorbed 96% in the current, but only 67% on development. That the county executive to ensure that projects are procured early. This is a problem with the Department of Water and also the Department of Education. That is why they have very minimal absorption of development because of rate preparation of BQs. Number 5, that not later than 7th April on 2026, that the County Executive Committee member for Finance, Economic Planning, ICT, and Revenue does furnish the County Assembly with KDSP grant bank statement for both level 1 and level 2 inception and a list of all projects funded by KDSP. We noted there is a lot of discrepancies. You have noted in the report, and it's as a result that we don't receive the actual grants we receive as a county. When we budget and what we receive as a county when it comes to grants, we don't get that report. And as a result, we have requested the CCM Finance by 7th of April to give us the list so that we can be able to reconcile. Because we budget as a some figure, but most of the cases it is not that, or we receive all that money, we may receive more or even less. So that is why we want a breakdown so that we can be able to reconcile. Number 6 is that not later than 30th April, the County Executive Committee member for Finance, Economic Planning, ICT, and Revenue does submit a list of historical incurred earlier than 30th June 2025 pending bill, both the development and the current, with support. All of us knows what has happened even at the Senate. Currently, the Nyandarua County has been declared insolvent. We are being told that we have a pending bill of 4 billion. Nobody can be able to confirm or clarify how we are at 4 billion. I know there is some kind of misinformation. We need to know actually what is our pending bill, which at the committee we believe it is around 1.4 billion. But when we start hearing of figures like 4 billion, it means there are some, we have heard, there are some might be cooked pending bill for future payment. So we need as a budget committee to clarify. We want to know exactly what is our pending bill. And I think by that year, April, we'll get the information from the CCM. That the County Executive Committee member for Finance, Economic Planning, ICT, and Revenue should ensure pending bill are treated as first charge and should be itemized. You know what happened, Honorable Speaker, in the last budget, out of consultation with the executive, we did not itemize the pending bill because we wanted them to first of all clarify and they pay the payables. But what happened is a regret to this county. So we have said going forward, we are going to itemize all the pending bills. So the Executive Committee member for Finance, Economic Planning, ICT, and Revenue does ensure that going forward, the county treasury maintain consistency and cohesiveness in its reporting requirement and document. This is to avoid the discrepancies that we have noted. I therefore request this House to adopt the report of the Budget and Appropriation Committee on Nyandarua County Budget Review Outlook as a report of the House. Honorable Speaker, I invite Honorable Gitau, member for Orkara Ward, to second.
Honorable Speaker, I second.
I propose the question, which is that this House does adopt the report on of the Committee on Budget and Appropriation on the Nyandarua County Budget Review and Outlook Paper, CPROC 2025, as a report of the House, and the recommendation therein as the resolution of the House. I now put the question that, which is that this House does adopt the report of the Committee on Budget and Appropriation on the Nyandarua County Budget Review, Outlook Paper, CPROC 2025 as the report of the House and the recommendation therein as the resolution of the House. May those of a similar opinion say aye. May those of a contrary opinion say nay, and the ayes have it. Next order.
Mr. Speaker, sir, the business of this sitting as appearing on the order paper has been exhausted.
Thank you. I think on this juncture, I would wish to really thank the committee on budget with those recommendations that you've come up with. Make sure that we have a report. There being no other business to transact during this sitting, I now adjourn the House to Wednesday, the 4th day of March 2026 at 2:30 p.m.